The world has reached a grim milestone. According to the Johns Hopkins University in the U.S., the coronavirus pandemic has now claimed more than 10,000 lives across the world. Now, the majority of those deaths are no longer in China, where the virus was first detected, but in Italy. There, almost 3,500 people have died, and the cases have now, infections have surged past 41,000. Well, the region of Lombardy in northern Italy is the hardest hit. So many people have died there in recent days that cemeteries are no longer able to cope. But Lombardy isn't the only flashpoint. Hospitals across the country are running out of space, and doctors and nurses say they cannot manage for much longer.
Italy is racing against time to provide more intensive care beds like this. Here in Rome, the newly built Columbus COVID-2 unit is already taking patients, and more dedicated hospitals are on the way. Officials fear the dire situation in Italy's north could soon start heading south. On Thursday, Italy surged past China as the country with the most coronavirus dead. A milestone marked with grim images of army trucks transporting hundreds of coffins from the worst-hit region of Lombardy. As the death toll mounts, those trying to help the living are struggling to cope.
We're working in a state of very high stress and tension. Psychological stress has gone through the roof. Unfortunately, we can't contain the situation in Lombardy. There's a high level of contagion, and we're not even counting the dead anymore.
And the strict lockdown has left the most vulnerable patients all alone.
The greatest problem which is emerging these days, I would say, is that the patients can't be visited by their relatives and often die on their own.
As Italy's corona crisis explodes, China has sent medical teams and equipment to help. But the Chinese Red Cross says their hard-won advice is not being heeded.
Here in the city of Milan, which is in the hardest-hit region, you don't have a very strict lockdown policy. The public transport is still working, and people are still moving around, and you're still having dinners and parties in hotels, and you're not wearing masks.
Italian streets are empty, but for many, they're haunted by the prospect of more army trucks and more bodies.
All right, for more on this story, we can speak now to correspondent Seema Gupta. She's standing by in Rome. Hi, Seema. We heard that criticism from this Chinese Red Cross worker there, that people are not heeding this lockdown. They're still out and about on the streets. Is that true?
Well, what we're seeing here in Rome is that people do keep that social distance, that 1 meter or more space right in front of the supermarket. The lines are long simply because of that space. People, though, are still going about in terms of taking a walk or going for a jog. I think part of it is because they feel, OK, I'm taking the precaution in terms of space. And also there's a frustration of being indoors all the time. But because we're seeing these massive numbers in terms of the number of people that have succumbed to COVID-19 and the fact that this disease, this infection spreads with such speed, they're now calling on everyone to change even that. Doctors and officials are saying, do your sport at home, don't go out. They're calling for a staggering of supermarket timings so that there's a limit of people moving out and about to get their essential supplies. The authorities are saying if everyone is responsible, we can actually do our part. Now, in Lombardy in particular, the president of the region is calling on the authorities to bring in the army and enforce the lockdown. They want a closure of public offices as well as building sites. And to give you an idea, the hospital administrator in the hardest hit town of Bergamo is telling the people in Milan it's better to isolate than to be dead. And so clearly bringing out a very important message, as well as mayors in these smaller towns, please stay at home.
Well, Italy is really struggling to cope, Seema, and we heard the Prime Minister today calling on the European Union to unleash what he called the full firepower of its rescue fund for countries that are struggling. Just briefly, is Italy getting enough support from Brussels and its European partners?
Well, what they're saying is that you have the ECB coming in and buying up those bonds, which clearly, in a way, does help the markets. But as Prime Minister Conte has said, this is a shock to the system without any precedent. And so he wants the European Union to use that 500 billion fund in order to help the economy here in Italy. And other European leaders are calling for the same, a united way of dealing with this.
All right, correspondent Seema Gupta reporting for us there from Rome. Thank you very much. Now, here in Germany, the country's disease control center is reporting that the number of cases has jumped again. The Robert Koch Institute says there are now 13,957 people infected with the virus and 31 people have died. Earlier this week, Chancellor Angela Merkel appealed to Germans to stay indoors to help slow the spread of the disease. Since then, more and more senior figures say Germany needs a mandatory lockdown. One city has already taken that step.
Empty streets, a sight Freiburg will have to get used to after the authorities announced a 2-week lockdown. It's the first German city to order residents to stay at home. Many are now asking themselves if the whole country could be stuck indoors soon, including Sarah and her friends, who are out enjoying the sun together, despite the appeals not to.
It's probably better so people don't get infected, and the hospitals are already overstretched. But it's hard to imagine in a country with so many people like Germany.
So you're not thrilled?
Absolutely not.
Most of those gathering in the park know they shouldn't, a fact they find hard to accept. In this residential area nearby, many are staying at home, but it's hard.
I'm not doing well. I'm going to cry. Because I can't see my children. You say something.
It's a real shame that we can't see our children, and especially our grandchildren. But we accept it. We do what we're supposed to. We're keeping our distance.
Keeping distance. Berlin's Brandenburg Gate is pretty empty, and those we spoke to expect a lockdown.
It'll be here in a few days. That's why we're out now.
The town of Heinsberg is a coronavirus hotspot in Germany. The mayor is appealing for reason.
High-risk groups are self-isolating. They only go out to the doctor. The others restrict their movement to a minimum. They drive to work and buy essentials.
The threat of a lockdown is weighing on people's minds.
We're experiencing the biggest loss of personal freedom since the Second World War. 2 weeks ago, there were soccer matches with 50,000 fans. It's not easy to change so radically from one day to the next. The government is trying appeals. If they don't work, bans on going out will follow.
3 communities in Bavaria are under lockdown. The state premier says that soon could be expanded to the entire state.
Now is the time to make decisions. We have put some measures in place and hope that they work. But no one should be under any illusions. We're determined to do what it takes, and that could mean a lockdown.
Freiburg has taken that decision. The lockdown goes into force on Saturday.
As infections spread across the globe, the most populous state in the U.S., California, has advised its 40 million citizens to stay at home, except for essential jobs and errands and some exercise. Well, the announcement in California follows an extraordinary alert from the U.S. State Department. Americans have been told not to travel out of the country under any circumstances. Citizens abroad should return to the U.S. immediately unless they plan to remain overseas.
U.S. airports are grinding to a halt. This empty airport in Seattle reflects a nationwide attempt to curb further spreading of the coronavirus. Instructions to isolate are also becoming more urgent. The most populous U.S. state, California, issued a stay-at-home order starting Thursday night.
There's a mutuality and there's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home. That directive goes into force and effect this evening, And we are confident that the people of the state of California will abide by it.
According to officials, over 50% of Californians could be infected with the coronavirus within 2 months. Spring breakers around the country have been ignoring warnings to avoid large gatherings.
We do care about our health. It is like a big concern, but my thing is one day we're gonna die, so might as well go out with a bang.
In other U.S. states, virus testing is being rolled out to provide a clearer picture of the scale of the outbreak. In New York, 6 drive-through centers aim to test hundreds of people a day, but officials have said there could be problems sourcing enough testing kits. In Houston, Texas, drivers and passengers queued up for over 2 kilometers to get their swabs taken. The mayor of the city says testing capacity is insufficient.
There's not enough testing available right now to meet demand. We hope to start tomorrow. That would be on a limited basis, and primarily the focus will be on first responders and healthcare providers.
Some experts believe that the lack of an effective testing system has allowed the coronavirus to spread undetected in the U.S. for weeks.
Let's take a look now at some other corona-related developments around the world. U.S. President Donald Trump has canceled plans to host the Group of 7 G7 summit in June. Instead, he will meet with leaders from the world's wealthy democracies via video conference. South Africa's health minister says confirmed cases in the country have risen by 52 to a total of 202. A hard-hit Iran has appealed for international pressure to bring an immediate end to U.S. sanctions so it can import medicine and equipment desperately needed to fight the pandemic. Health officials in Australia say nearly 3,000 passengers who disembarked from a cruise ship in Sydney on Thursday were ordered to self-isolate after 3 of them tested positive. Well, as the outbreak spreads around the world, we wanted to take a look at some of the science behind it. So what makes a virus contagious? And what exactly happens during an infection? Our science team took a look.
Several thousand species of viruses have been classified so far, but researchers believe millions more are left to be discovered. Only a tiny fraction, just a few hundred, cause disease in humans. Many of these infectious pathogens, including the one that causes COVID-19, are transmitted via droplets when someone who's infected coughs or sneezes. A virus is little more than a collection of genetic information protected by a protein coat. It's not viewed as a full-fledged form of life because, unlike life forms, it doesn't make its own energy. It has to steal energy to make more of itself. To replicate, a coronavirus has to invade living cells, like those in the lung of a human being. First, viruses like SARS-CoV-2 dock on specific receptors on the cell's outer membrane. Once attached, they can either be absorbed entirely by the cell or inject their genetic sequence into its interior. The cellular machinery is then hijacked to churn out more viral envelopes and sequences. When assembled, the new viruses then burst out of the infected cell to infect others, usually killing the host cell in the process.
Our science correspondent Derek Williams put together that report for us. He joins us now for more. Hi, Derek. You've been following all of the latest developments on the coronavirus pandemic. What are researchers talking about at the moment?
Well, on the prevention and treatment side of things, there's been a lot of chatter about an attempt to develop a vaccine in the UK, which they fast-tracked. The researchers have said if all goes well, they could have a viable candidate by the end of this year, though pretty much every expert out there continues to say that we won't be seeing a vaccine before mid-2021 at the earliest. There's also been a spike in excitement about possibly treating the disease with an anti-malarial medication. But with treatment still somewhere down the line, a lot of the focus is on the measures that different countries are implementing to try to contain the spread of the disease and to what extent they could influence or accelerate what's called herd immunity.
Yeah, herd immunity has been mentioned a lot, Derek, especially in the context of the UK. I mean, what exactly does it mean?
Well, herd immunity is the goal in an outbreak. It describes a situation where so many people in a population are immune to an infection that it can effectively stop the disease from spreading. So people can grow immune in one of 2 different ways. Either they can catch the disease and build up an immune response that'll prevent them from being infected by the same bug in the future, or they can be given a vaccine that provokes the same response, even though they didn't catch the disease. So for the purposes of herd immunity, it doesn't really matter which of those two ways they develop an immune response. What's important is that as the number of people who are immune to the bug grows in a population, the slower the bug begins to spread. So imagine a situation where you're at the beginning of this outbreak and no one is immune, and an infected person gives it to 2 other people. Well, once 50% of the population has acquired immunity, then an infected person can only statistically give it to 1 other person rather than 2, because the other one would have been given, that they would have given it to is already protected. So rising immunity in the herd and society as a whole acts on as a brake on the spread of the disease. But there's been a lot of discussion in Britain and the Netherlands in particular about trying to reach herd immunity in a controlled way in their populations. But that means that with where we are right now with no vaccine, the authorities would basically have to accept that large numbers of people are getting sick quickly, so their immunity would help protect the rest.
Yeah, Derek, what does the science say? I mean, can herd immunity really work as an approach here?
Well, some epidemiologists say it's an interesting idea, or at least it would be in an experimental setting, but pretty much all of them seem to agree that trying to implement some kind of controlled herd immunity in a rapidly evolving scenario like the one that we're in right now would be insane for a couple of different reasons. First and foremost is, of course, the big question of immunity to the virus. We assume there's going to be an immune effect after someone's caught COVID-19, but we still don't know much about that or how long it will potentially last. And allowing a virus to spread when you don't know whether people could become susceptible a second time is a huge risk. There's also the question of how controlled measures would remain. The whole point behind social distancing measures is to slow disease spread, flatten the curve until you've got the medicines and vaccines in place. So it's far too easy to imagine a scenario where intentionally allowing people to catch the disease could spiral out of control. And at least for now, the researchers that I've talked to and read are saying, don't do it.
All right, our science correspondent Derek Williams reporting for us there. Derek, it's always good to talk to you. All right, let's take a look now at how the global coronavirus crisis is affecting business. A luxury car maker, Bentley, will halt its car production in the UK for 4 weeks. The decision was made to keep employees safe. Also, due to the pandemic, there is growing uncertainty regarding parts supplies. The British luxury brand is owned by Volkswagen. That German company announced its own shutdowns earlier this week. And German Economy Minister Peter Altmaier wants to loosen antitrust laws to allow greater cooperation between retail businesses in the fight against the virus. The magazine Der Spiegel quotes Altmaier saying that the government is willing to allow closer cooperation between the food industry and retail sector to secure supplies in Germany. Well, the virus is also having a huge impact on financial markets around the world. After historic drops, things are looking a bit better on Friday. A share surged more than 7% in South Korea and 5% in Hong Kong. Investors seem optimistic after governments and central banks rolled out measures to cushion the economic fallout from the pandemic. And there is more to come. China is reportedly set to unleash a fiscal stimulus worth trillions of yuan. In the U.S., the Senate is mulling a $1 trillion package that would include support checks for most Americans and relief for small businesses.
Impeachment is adjourned until Tuesday.
And let's go right to our correspondent, Chelsea Delaney. She's standing by for us at the Frankfurt Stock Exchange. Hi, Chelsea. Good to see you. So there's been some relief on European markets this morning, but overall, it's been a pretty rough 2 weeks. So what are things like there today?
Well, there is definitely cautious optimism heading into the weekend. The DAX is up about 5 to 6%. But as you can see behind me, it's getting increasingly quiet here at the Frankfurt Stock Exchange. And I think it's also important not to read too much into these one-day upswings in the market. The economic impact of the virus is going to be severe, and we still don't know how severe it's going to be because we don't know how long the outbreak and the measures that governments are having to take to contain it are going to last. But over the past week, we've just been seeing so much activity on the behalf of governments and central banks. We've seen 31 central banks come in the past 5 days and cut interest rates. Governments preparing trillions of dollars worth of stimulus, and that is helping to stabilize markets.
Chelsea, there are also some concerns surrounding the U.S. dollar. Can you tell us more about that?
Well, this story has been a little bit in the background, but it's extremely crucial because the dollar is really the foundation of the global financial system. It's not just the currency of the United States. It's the currency that when governments borrow money, when companies borrow money, when banks borrow money, they often borrow in dollars. If you're a global company, you often pay your receipts for supply chain things in dollars as well. And this week we've seen a lot of hoarding of dollars as people get out of the market and try and get cash. They've been buying a lot of dollars, and this means that all of these companies, all of these banks and governments aren't getting access to the dollars they need. And this could be, investors say, a systemic risk for the financial system at this point. We have seen the Fed take some actions in the U.S. to provide more dollars, but investors are still quite concerned about this shortage of dollars right now.
All right, our markets correspondent Chelsea Delaney there for us. Thank you.